Okay, so welcome to our second to the last educational Embracing Wellness series class tonight. It is a class format that we've not done before. It's a Q&A, so I'm excited. We had some patients that emailed us questions ahead of time, but I'm willing to entertain any questions tonight, just, you know, off the cuff. So, because the ones that we have, there's not that many, so we'll have plenty of time for just impromptu questions as well. A few housekeeping issues. Who's new? Who's never been to a class before? Oh, I love it. Great. Awesome. Well, welcome, and thanks for giving up your evening to come over with us. Our next class is November 18th, and it's going to be here. The topic is You Don't Have to Live With It, and it's all about the importance of hormonal balance for both women and men. So that will be a topic that I think a lot of patients struggle with, because hormone imbalance is not just about menopause as it pertains to men. Because for those of you who aren't aware, we did start offering our services of hormonal balance for balancing for men, and our wellness program is now open for men, the TLC program. We had so much interest in the program from our female patients that they really made us look at our services in a kind of a broader scope, and we realized that we do have so much to offer that we wanted to be able to extend the wellness program for men as well. So those are the two aspects that we're offering for men: wellness and hormone balancing. And then lastly, just remember that as the holiday season is approaching, we have lots of things here that would make good gifts. I mean, gifts that people would truly know that you cared, gifts of health. And there's a lot of gifts that you can give patients or friends, but I think in terms of gifts of health, I think that really comes from the heart. So if you are interested in that, we have gift certificates for anything in the retail center. We have gift certificates for services with Leslie, our personal trainer and registered dietitian. We have certificates that patients can use towards the new infrared sauna that we're really excited about. That should be up and running in a week and a half or two. So, and there's a handout on your seat if you're not familiar with the benefits of far infrared sauna therapy. We're really excited about it, and I can't wait to have that up and going. So the format tonight is Alice, who is my sister-in-law, who has been working with me since day one, 13 years ago, who's like my right hand. She's going to pretty much be the moderator tonight, and she's going to read the questions, and I'll repeat them, and then I'll go through the answers. And then, like I said, this can be very, very, very informal. So I want you guys I want this to be a dialogue. It can be, you know, questions that you think, I mean, no question is a stupid question. I want anyone to ask anything that they have on their mind. So thank you. All right, Al, go ahead.
Okay, we'll start. The first question is, do you give your kids probiotics, and if so, what brand and strength?
Yeah, I do give my kids probiotics for a number of reasons. And does everyone know what probiotics are? Okay, so the question is, do I give my kids probiotics, and is everyone familiar with probiotics and the benefit of probiotics? So probiotics are the beneficial bacteria that make up our microbiome. Our microbiome is the population of bacteria that resides in our gut. And currently, there are hundreds of articles right now in the medical literature on the importance of the microbiome, because everyone's microbiome is different. It's like your fingerprint. There's no two people in this room that have the same microbiome. But the importance of the microbiome is that it's now being linked to increased risk. If your microbiome is not optimal, it increases our risk for chronic disease, such as heart disease, cancer, Alzheimer's, and diabetes, and other chronic morbidities. So the importance of the microbiome I cannot emphasize enough. And unfortunately, there are a lot of things in our environment that are detrimental to our microbiome. First and foremost, how we come into this world. I mean, we don't really have much control over that, whether we're born vaginally or we're born by a C-section. Children that are born by C-section have a totally different bacterial microbiome than children that are born via a vaginal delivery, because that's how we get our microbiome. We pass through our mother's birth canal, and that's how we get our bacterial content that we're going to have. So when you're born by C-section, you're born into a sterile environment, okay? So there are no bacteria that you get in your gut for the most part when you come out via C-section, or very little. So then breastfeeding can help to colonize the baby's gut. So then breastfeeding is the next best thing to help a baby start out in this world with a good microbiome. Things that are detrimental to the microbiome from when we're young are antibiotics. So how many kids go to the pediatrician and get antibiotic after antibiotic after antibiotic for an ear infection or a cold or what have you? So several doses of antibiotics will then eradicate the good bacteria and set us up for what we call dysbiosis. That's just an imbalance in the good bacteria. The standard American diet is another thing that will sabotage our good bacteria. So sugar, highly processed carbs, pesticides, foods that we really don't recognize as being food, with labels and ingredient lists that are, several lines long. So all of those things and genetically modified foods, all of those things will have an effect on our microbiome. And then stress. Kids are no different than adults when it comes to stress. Our stress just comes in different ways, but kids can be under a significant amount of stress as well. So for all of those reasons, I give my kids probiotics to help protect them and to help their immune system, because that's really another very important role that our microbiome plays, is to help our immune system be as geared up, so to speak, as possible to help keep us healthy. So I use Orthomolecular Springboard. They have a Springboard series. It's called Flora Boost. That's just one of several good probiotics for kids, but I like that one because it's powder form. So if your kids are real little and they can't swallow capsules, you can put it in their water. You can put it in any a beverage that they're drinking. You can sprinkle it on their food. It has a nice balance between Lactobacillus, Bifidobacterium, and Saccharomyces boulardii. So it's a very comprehensive probiotic, so I like that one. Designs for Health makes good probiotics. The one caveat I would say about probiotics is quality does matter. So when you go to the store and when you go to the aisle where there's probiotics, there's 200 probiotics staring you at the face in the face, and you're like, I have no idea which one to pick. And the problem with a lot of the probiotics that you can get are that the number of bacteria and the type of bacteria really do matter. And the issue is when they make the probiotic, they may say that there's 20 billion strains of those bacteria when they package that product, when they made it. But after it sits on the shelf for a month, 6 months, 8 months, there's not 20 billion strains of that probiotic anymore, of those bacteria anymore. So products that are processed in a way that the bacteria numbers are still there 6 months or a year after they've made the product is really important. And those are typically the products that are from companies that are independent, subject their products to independent tests to make sure that those bacteria numbers are still high. And then the next thing that I do, because I truly believe that probiotics are important, but it's just one piece of the puzzle. You try to get your kids to get their good bacteria from the diet as well. So you want to make sure that you're feeding your children healthy foods that are prebiotics for the probiotics. Food that those bacteria are going to be eating. So again, the standard American diet is one that's not exactly conducive to a healthy microbiome. Did that answer that question? Any questions on probiotics?
What are a couple of prebiotic foods?
Prebiotics, yeah. So prebiotics would be like fiber. So foods that have fiber, artichokes, Jerusalem artichoke. Those are just kind of some of the examples. But any foods that have some of the fermented foods also are good prebiotics. So yeah, so prebiotics are just the foods that help kind of feed the bacteria, the good bacteria that you're wanting to proliferate in the gut. Yeah, as opposed to sugar. Sugar is not, sugar and highly processed carbs and foods that are just basically chemical ingredients aren't good prebiotics. But, green leafy vegetables, fruit, non-processed foods. Yes?
What do you know about Floragen?
Floragen, yeah, Floragen is not a bad probiotic by any means. It's a, for the most part, kind of a relatively common, easily obtainable probiotic. It's usually, you can usually find it in a number of places, and I think out of several on the market, or over the counter, that one tends to be okay. Yeah.
You're seeing microbiome.
Biome, B-I-O-M-E, microbiome, yeah. And if anyone's interested in learning more about the microbiome, let's see, September. It was July's newsletter article, I believe, June or July. We did the big, my article was about the microbiome. So if you guys don't have that one, we can pull the archives on that.
Should the probiotics be refrigerated?
It depends on the brand. Like the one that I was talking about, the orthomolecular series, those do not need to be
That's why I was
refrigerated because those are freeze-dried. So they don't necessarily need to be refrigerated. But a lot of the over-the-counter ones that you may, or other over-the-counter ones that you may find do need to be refrigerated. So it's very much brand dependent, and you just want to look at the package and see. Yeah.
What's a good dose for a child versus an adult?
You know, it's a good question. And again, it's also kind of dependent on the brand. When you look at the number of billions of strains, usually they're, depending on the age of the child, it can be anywhere from 1 billion to 5 billion strains. If they're, 8 to 10 years of age or older, they can be up into the 10 billion strains of bacteria. Adult, usually an entry-level adult probiotic is about 20 billion strains. And if anyone goes on an antibiotic, you definitely want to take a probiotic. You just don't want to take it physically at the same time that you take your antibiotic, so separate it by about 2 or 3 hours. If you're going into the hospital, definitely take a probiotic. There's lots of things you don't want to pick up when you're in the hospital, so take your probiotic.
I read a study that showed THERAMINE helped low back pain better than ibuprofen. Do you prescribe it?
Yeah, so THERAMINE, this one I had to research a little bit. THERAMINE, and I was really impressed with it, and I think Melissa, who asked this, is not here, but in her behalf. So THERAMINE is a product that is prescription only. It is what we call a medical food. So it's somewhat related to a supplement, but it's a little bit more regulated by the FDA as opposed to just a supplement that you can buy anywhere. So a medical food is usually a product that has that the FDA is monitoring because it has a definite indication. So like for THERAMINE, that's indication is for back pain or joint pain or some of these chronic pain syndromes. THERAMINE is basically a combination of different amino acids, and amino acids are the building blocks for our proteins. So it has arginine, it has choline, it has glutamine, and the reason why these work is because they basically will dampen down pain and inflammation, because what they're doing is they're influencing our neurotransmitters like serotonin and GABA, and serotonin and GABA and acetylcholine. Those talk to our brain. Our neurotransmitters are those chemical messengers that talk to our brain, and so they can dampen down the pain signals coming from our brain. So THERAMINE, in 2 independent studies, one was against ibuprofen and one was against naproxen, THERAMINE worked better than both of those in those studies. So THERAMINE is it comes in capsule form. It has to be written by, it's a prescription that would be written by a physician, but it's definitely looking promising as a way to get some of the opioid effects of a narcotic without a narcotic. It's just basically using amino acids or building blocks of our proteins to send the chemical signals to our brain via our neurotransmitters, and it really looks promising. So I'm excited about this, and I learned something in researching this product. So THERAMINE, it's THERAMINE. Yeah.
Okay.
Can I ask one quick question?
Yes.
Piggyback on that. Would
Yes.
that potentially be helpful for like monthly migraines?
They haven't studied it for monthly migraines yet. They've studied it mainly for joint pain and chronic low back pain. But I think the more that they look into how influencing these neurotransmitters can help to engage our parasympathetic nervous system to then kind of dampen down our cortisol and help with pain control, I think that there will definitely be more applications. So I think a lot of the chronic pain syndromes, whether it be migraine or fibromyalgia, I think we'll definitely see THERAMINE being used for that more.
So it's just something to watch.
It's something to watch. It's definitely new in the medical food arena.
It's kind of based on amino acids.
Yes.
Something with the protein in your diet.
That's a good question, and I read about that. So it's not something that you can necessarily ingest enough of in your diet in the right combination. So I did wonder that myself, and when I researched it, I thought it made sense. So it's usually best and most effective when it is in supplemental form.
So would you take it every day then?
It is every day. I believe it's twice. No, I'm sorry. I believe you can dose it every 4 to 6 hours. Yeah.
Okay. 6 months ago, my OB-GYN diagnosed me with PMDD and told me the best solution was to start taking Zoloft, which he claimed he prescribed 3 times a week. I urged him to run a hormone panel for me, for which I was told was fine to run during the time of month when I wasn't having any PMDD symptoms, and all the levels came out normal. I then dove into hormone balancing books and have completely changed my exercise routine and diet, almost all organic whole foods and animal products from a local organic farm. After 4 months of this, PMDD symptoms are as bad as ever, lasting up to 2 weeks. I'm tired of feeling angry, screaming at my kids, not getting sleep, and craving alcohol just to feel normal for an evening. Her question is, what causes PMDD and what is the solution?
Okay, so what causes PMDD and what is the solution? So PMDD is a severe form of PMS. It's premenstrual dysphoric disorder, and it's kind of at the far end of PMS, whereas PMS may just have some of the emotional symptoms and a few of the physical symptoms. PMDD is a lot more of the emotional symptoms. Patients may get extremely depressed, kind of dysthymic, and it can be pretty devastating. So the patient's question, it sounds like, what options are there other than Zoloft, an antidepressant for PMDD? Well, I think just like we would tackle any other problem here, looking at the entire picture is critical, because you have to dive into, first and foremost, what's going on hormonally with this patient. She had said her doctor had run a blood test to check her hormones. Blood tests are great for hormones, but for PMDD, when you're trying to see what's going on throughout the entire month, drawing one blood test throughout a 28-day cycle doesn't necessarily give you the whole picture. So we've had better luck with doing salivary testing throughout the entire month. So it's kind of a comprehensive saliva test that looks at, we call it a 28-day saliva test, but it looks at 11 different days throughout that menstrual cycle. So we'll check hormones at the beginning, called the follicular phase, and then we'll check hormone levels after ovulation throughout the luteal phase, because you really want to see what's going on throughout that entire month to see if maybe her estrogen and progesterone are out of balance. And otherwise, you're just going to basically be throwing things at her that may not work. So if her estrogen and progesterone are completely normal throughout the month, you can rule out a hormonal etiology and then move on to something else. If her hormones are not balanced, if she has a luteal phase deficiency or her progesterone is really low, then you can talk to her about natural ways to raise her progesterone, using some bioidentical or natural progesterone, and lifestyle options that can also help with hormone balancing. The second thing you need to look at in a patient like this is what's going on with just in stress in general in her life, and does she have a tendency to be depressed throughout the month, or is this only just with her cycle? So you have to look at what's going on stress-wise. What does her diet look like? A lot of times, once you take a very detailed dietary history, you can figure out some clues as to why this patient may be having some depressive type symptoms, especially when you think about the fact that 70% of our serotonin is made in our gut. So our serotonin, which is the neurotransmitter that all of the SSRIs target. So 70% of our neurotransmitter serotonin is made in our gut. So if this patient's gut is not healthy, you can throw all of the Zoloft at her in the world, and it's really not going to make that much of a difference because you have to get to the root of the problem. Exercise, you have to ask her if she's exercising. We know exercise is one of the most important and one of the most fundamental practices that we recommend for improving mood. And I think when you take kind of this comprehensive history of this patient and really dig deeper, you can get to a lot of times get to the root of the problem. So I find most importantly, top 3, hormone balancing, cleaning up their gut and diet, and adding back maybe a few key supplements that may help with PMDD, such as omega-3 fatty acids, especially DHA, which is great for brain health. Plus they're anti-inflammatory, so they can work for some of the physical complaints that she may have with her period. Vitamin D, very important. Again, I think vitamin D is more of a pro-hormone than a vitamin. There's vitamin D receptors in every part of our body. Calcium and magnesium can also be very helpful for PMDD symptoms. So I think it takes a multifaceted approach, and she wasn't born with a Zoloft deficiency. So if we can just try to get to the root of the problem, I think it works better.
This is a question for you.
For me.
Is it true that you have started eating foods derived from animals, and why?
Okay, question for me. Is it true that I've started eating foods derived from animals, and why? Okay, yes, I guess she knew me when I was vegan for about 4 years. So yes, I did start eating animal products, mainly fish, because I'm absolutely convinced of the importance of obtaining omega-3 fatty acids for brain health and heart health. And the more that I delved into the importance of omega-3 fatty acids and getting them from their natural source, not that algae is not a good way to get omega-3s, it can be. I just felt that the benefits outweighed the risks. And so I did start adding animal products into my diet. I don't even know if she's here to ask that, but that was the answer. Oh, you're here. Okay.
The reason is I'm just going into this vegan path.
Okay.
I'm trying to look at all the evidence that's out
Okay.
there, and I was curious.
Okay, so let's go through that. So, you know, I think I've listened to pretty much most of the gurus now on nutrition. As the 2 years I spent with Dr. Weil, and then I've been following Dr. Mark Hyman and David Perlmutter and Walter Willett from Harvard. I've sat in all of their lectures, and the way I look at it is, no matter who you listen to, I think it all boils down to moderation. Moderation. I think Mediterranean diet, I think if we could have a perfect diet, I think some hybrid between Mediterranean, traditional Japanese, and a little bit of the aspects of paleo, if we could have a perfect hybrid of a diet, I think it would be that. There's definitely benefit. The Mediterranean diet, when I speak of that, I mean mostly vegetables and omega-3 rich sources of seafood, fruit, unprocessed grains in moderation. But I think if we could have the perfect diet, it would be a hybrid of some of these things. There's plenty of evidence about the importance of vegetables and abundance of vegetables in our diet, but I don't think you need to take it all the way to veganism to get the benefit of vegetables in your diet, if that answers that question.
I've heard a variety of different opinions regarding the pros and cons of eating soy-based foods.
Yeah.
However, if an individual has estrogen dominance, should they or should they not consume soy foods?
Okay, so the question is it okay to eat soy-based foods? And if someone is estrogen dominant, and that goes for men too. Men can be estrogen dominant. If they have low testosterone and their estrogen to testosterone ratio is out of balance, then men are estrogen dominant. So is it safe for patients to consume soy? You know, I think, again, it depends on what kind of soy we're talking about. Unfortunately, the majority of soy is now genetically modified. So first and foremost, if you're going to have soy, you want to make sure that it's not genetically modified. Second of all, you want to eat soy in its unprocessed state or minimally processed state, like and even like miso or tempeh or edamame. Those forms of soy tend to be more nutritious, so to speak, than processed soy, like soy milk or soy protein or soy bars, like Luna bars. So I tell patients, don't go to the health food aisle at Hy-Vee and just stock up on soy protein to make your smoothie and then soy bars for your snacks and all that. That kind of processed soy is going to give you absolutely no nutritive value, but can actually be detrimental. So if you're eating soy in its unprocessed state in moderation, I think even if you're estrogen dominant, that is okay. In moderation, no more than a serving a day. The other thing too, look at how I'll go back to that comment that I made about the perfect diet does, in my opinion, does have some of the aspects of the traditional Japanese diet, and they would eat soy, but more as a condiment as opposed to eating a soy burger at every meal, which I think sometimes we'll use soy filler as a way to avoid animal protein. And I don't think that's how soy is intended to be eaten. Do I have a problem with soy being that it has weak estrogen-like effects? Usually not. However, if you are a breast cancer patient, I would say that, and a prostate cancer patient for men, I would say that, again, I wouldn't make soy something that you're eating several servings of a day, but again, a little bit here and there should not cause a problem.
Is tofu considered how processed?
Oh, I'd say minimally in the grand scheme of things, so tofu would be okay. Do you guys know how to make, oh, go ahead.
So I heard you mention some doctors that you don't follow.
Yeah.
And just a general question about, I struggle a little bit when I hear some, and I only have heard about this peripherally through my wife, some of the nutrition issues. And I struggle when I hear comments made about, oh, Western medicine does this and that, as if it was, cucumania, or just something not really based on data, robust analysis. And that's what I'm glad to hear you talk. And when I think about, if I had to try to get information about how the human body works, I would look at an MD and somebody who does research, analysis, looks at robust data. And when you give these talks, do you base most of your information on that kind of information, or is it based on non-medically?
Yeah, that's a good question. What is your name?
Ray.
Rick? So Rick asked, Ray, sorry. So Ray asked, do I base my talks, how I practice medicine on evidence-based medicine, or more just empirical data? Well, I think anybody that, that's a very good question, and I appreciate you asking that, because that's very important. So I'm very much grounded in evidence-based medicine. It's how I was trained as a traditional MD, and it was how it's what I respect. When I was researching the THERAMINE question, the first thing I go to is PubMed to try to find what's in the medical literature, what's been studied. Are there any randomized clinically controlled trials of this? And that's where I found the data about it and naproxen and ibuprofen. So I very much am grateful for the traditional Western medicine training that I've had, but I'm also equally grateful to blend that with the best evidence-based medicine of traditional Chinese medicine and some of the other ancient healing traditions. But I think if I'm putting myself somewhat outside of the box, if I consider just, kind of a traditional Western medicine practice being inside the box, if I'm a little bit outside the box because I'm bridging traditional Western medicine with Eastern medicine and maybe some homeopathy and Ayurveda, I definitely have to have I have to be evidence-based because it's my first responsibility is to my patients, to make sure that I'm giving them sound advice. So first and foremost, it has to be grounded in evidence.
If you've had a complete hysterectomy, how often should you have a pap or pelvic exam?
Okay, if you've had a hysterectomy, how often do you need a pap smear or a pelvic exam? That's a good question. There are new guidelines that came out for pap smear screening in general, so we'll go through all that. But to answer that one specifically, if you've had a hysterectomy for benign reasons, not cancer, and you no longer have a cervix, so you had a complete hysterectomy, removing the uterus and the cervix, you do not need a pap smear. I still do a pelvic exam, and I still recommend a pelvic exam every year just to make sure that, especially if you still have ovaries, you need a pelvic exam. If you don't have ovaries, I still recommend the pelvic exam just to make sure that there is no sign of any prolapse. Make sure your bladder isn't dropping. Make sure that the tissues look healthy. The skin of our vulva is skin just like anywhere else, and you can get skin cancer. So I still think it's important that someone is, a healthcare provider is doing an exam once a year to check that. Women who haven't had a hysterectomy, the guidelines have changed. So it's now recommended that women 21 and under don't have a pap smear. So don't start doing a pap smear till 21. For women 21 to 30, pap smear every 3 years. And then 30 to 65, pap smear along with HPV testing for the virus that causes cervical cancer, that's human papillomavirus. You do a pap and an HPV test every 5 years, as long as they're normal. You can go every 5 years. And then 65 and older, the current recommendations say no pap smear. And again, those guidelines, I think, very much have to be individualized. You have to look at every patient's risk factors and what set of issues that this patient may be bringing to the table. So those are the guidelines, but again, they have to be very much individualized. So if you're at another office and they talk about the new pap smear guidelines, you'll understand what that means.
Is there help for postmenopausal women who have started having discomfort during intercourse?
Is there help for postmenopausal patients who have discomfort during intercourse? Absolutely. Again, this is where the bridge between traditional Western medicine and some of our alternative options come into play. So I'd say the kind of standard of care, traditional Western medicine answer would be to use an FDA-approved vaginal estrogen product. We try to keep it in the bioidentical realm, so an estrogen that is molecularly identical or identical molecularly to what our ovaries make. So that'd be something like estradiol. You can either use a prescription estradiol product for the vagina, or you can have one compounded. We have wonderful compounding pharmacists in the area. So that's an option. They can also add testosterone into that estrogen if patients have a testosterone deficiency, because testosterone is also important for the health of the vagina. If you want to use more, if you want to avoid hormones completely, organic coconut oil has been a wonderful treatment option for vaginal dryness and pain with intercourse. Organic coconut oil is a solid at room temperature. I tell patients they can apply a little bit every single day to the vulvovaginal tissues, and then they can use it as their lubricant for intercourse. We had a patient write in with an excellent idea about how to get the coconut oil, how to insert it easily, because it does melt quickly. So you can shape the coconut oil into kind of small little suppository type sizes, and you can actually freeze it. And then you can, it'll stay solid, and you can insert it easily that way. So coconut oil has been a wonderful resource for us, for patients who have a lot of vaginal dryness, who choose to avoid estrogen or who cannot use estrogen.
How is your spa set up? Could two friends enjoy it together, or is it strictly a one person?
Oh, the sauna. How is the sauna set up?
They have spa down.
So can more than one person get in the sauna?
Or is it just a one-person
It is
setup?
big enough to hold 2 people, but I would suggest maybe just one at a time. Because you're going to sweat a lot. I mean, you're going to sweat a lot. And I'm not sure you want to share that. Maybe you do. If you are seeking out a physician or a type of practice that does integrative medicine, you want to make sure that who you're seeing has done their due diligence to make sure they're giving you good care. So fellowship training is really important. There's now a board exam for integrative medicine, and that's another way to kind of set those of us who have done the training from those who haven't. So that's why we decided to open up our services for men, because we felt that there was a huge demand, but not a lot of places to fit the bill.
I am postmenopausal and have a low libido. Also, I cannot do the hormone pellets. Is there a testosterone supplement I could take or something else?
Okay, so postmenopausal patient with low testosterone, not able to do testosterone replacement in the pellet form, and is there an alternative? So testosterone, low testosterone is very common for both women and men. Women all have testosterone. We don't have as much of it as men, but we all have it. And unfortunately with menopause or andropause is male, is when male starts going through their menopause, our testosterone levels can drop. And the problem with low testosterone is that it can cause a variety of symptoms. Low libido or low sex drive is one of them. Fatigue is another. Brain fog, just not being able to process cognitively as well as you once did. Inability to lose weight or burn fat into muscle like you may have once been able to. Those are some of the common symptoms of low testosterone. Moodiness can be another one. So how do we add it back? You can add it back in a cream. For women, you can add it back in a bioidentical cream. That will help for mild testosterone deficiency, but does not work well if your testosterone levels are in the tank. The best way to get the testosterone levels up I truly believe is the bioidentical testosterone pellet, because number one, it's bioidentical. It's identical to what comes from our ovaries, or in men, identical to what comes from the testes. And it raises the testosterone level in a way that mimics our natural organs. So, and it gives us a sustained release of that testosterone over 3 to 4 months. But it will, unlike the cream, it will act like a functional organ because it will release more testosterone when we need it. So when we're at the gym and we're working out and we need more testosterone, that pellet is going to respond because our blood flow to that area where the pellet is increases because we're exercising. So that pellet's going to put out more testosterone when we need it, or when we're stressed and we need more. So that's why I like the pellet, because it's more physiologic. If you cannot do the pellet, the cream is an option. The other thing too that I always want to remember to tell patients with low testosterone, our lifestyle does make a big difference too. So exercise will naturally raise testosterone. Reducing stress will naturally raise testosterone, because testosterone is made by the same molecule, the same compound, cholesterol. That's where our testosterone comes from. It all comes from our parent molecule, cholesterol. Cholesterol goes down the chain, the enzymatic chain, and then will make testosterone, it will make cortisol, it will make progesterone. If we're really stressed and our body is cranking out cortisol, the body can't live without cortisol. That's our fight or flight hormone. The body can live without testosterone, so it's going to make more cortisol at the expense of testosterone. So if we don't get a handle on our stress, that's going to have a negative impact on how our body makes and how much testosterone our body makes.
Would it be bad for a postmenopausal woman to not take any hormones? I have no hot flashes and sleep well. I'm concerned about taking unopposed estrogen due to the talk about it raising the risk of cancer. I do have a uterus.
Okay, is it bad for a postmenopausal woman to not be on hormones? Absolutely not. If you don't need hormones, you don't need hormones. If you're feeling good, your quality of life is good, you have absolutely no complaints, you do not need hormones. So I think that, again, our lifestyle has a very significant impact on how we feel, both premenopausally and postmenopausally. And hormone replacement is there as a way to help facilitate or ease some of the symptoms of menopause, but by no means is it something that is absolutely necessary for all patients. It's wonderful when we can use it, if we need to use it, but I always encourage patients, if you don't need it, don't mess with it.
Do you treat for thyroid diseases and disorders? I'm looking for a gynecologist that will also treat my thyroid, postmenopause, and early osteoporosis. I'm currently being treated by a family doctor who's only prescribing medication based on test results which are far from optimal. Also, he's not helping with my diet and has no suggestions of what I should be doing for my osteoporosis. I've not had a pap test or a mammogram in almost 8 years, and I'm 57 years old.
Okay, so the first part of that question is, do we treat thyroid disorders? Yeah, thyroid, it's one of the most common conditions that we see. So definitely thyroid is ubiquitous, thyroid disorders. But you want to know if we treat it in relation to also osteoporosis. Mm-hmm. Yeah, again, I think this goes back to the kind of fragmentation of how traditional Western medicine is set up. So you go to a doctor to take care of your thyroid, and then you go to a rheumatologist to take care of your osteoporosis, and then you've got somebody to take care, you get your gastroenterologist to take care of your irritable bowel, and then you've got your neurologist to take care of the fact that you've got migraines. Whereas when we look at the body under this comprehensive lens of functional or integrative medicine, all of those things pretty much can be traced back to maybe a few common denominators, because bone loss is very much tied or linked to our thyroid, and our thyroid is very tightly linked to our hormonal balance for both men and women, and that can be linked to our migraines or how is our diet playing a role in this. So absolutely, when I look at a problem, if a patient comes and asks me to take care of their osteoporosis, I got to look at their thyroid, I have to look at their gut, I have to look at their hormones, you have to look at everything, because otherwise you're basically, again, just kind of maybe mopping up the water on the floor, but you're not turning the faucet off, because you're fixing the problems down below, but if you're not looking upstream to see why those things are happening, you're kind of missing the boat.
Sorry,
Yeah.
interject there? So maybe you talked about this in your previous lectures, I don't know. Integrated medicine, could you just give a very brief overview of integrated medicine? How much science there is behind that compared to just traditional medicine?
Yeah, so integrative medicine is just the specialty that kind of combines the best of traditional Western medicine with, again, the time-honored and evidence-based practices of other healing cultures. So the integrative medicine is just a term of that type of practice. Functional medicine is kind of a cousin of integrative medicine. Functional medicine, again, it's just kind of different camps, so to speak, but it describes, in my opinion, really the same type of practice style. And just like with any type of medicine, you can go to your traditionally trained MD and and he or she can treat you in a way that is absolutely 100% not based on science. Because the drug rep may have come in that day and brought in lunch and said, oh, this product is great. It's, it's going to help this, this, or this. But did that doctor really, and myself included, I'm not excluding myself, we as a whole obviously have to make sure that we are doing our due diligence at looking at the evidence. So I think that you can have it doesn't matter whether it's integrative medicine or traditional Western medicine, the onus is on us to make sure that we're using the evidence and practicing the evidence. So I guess I don't quite understand your question.
Well, I really don't know enough about it, or really what it is. So can you go to college? Can you go to Harvard and say, I want to go to...
Oh yeah, the Cleveland Clinic just started a functional medicine, integrative medicine clinic. So this is at, the large institutions. I think the problem is sometimes in the Midwest, we're sometimes the last to adopt some of these practices. But there are several several very, very reputable institutions across this country that are training residents on integrative medicine.
MDs that then just
MDs.
decide to-
MDs. I did mine at the University of Arizona. That's where I did my 2-year training. But there's places that, again, you can go to Cleveland Clinic, you can go to Harvard. Duke has a very large integrative medicine program. So it's,
So you have to be an MD first before
you have to, yes.
say you're going to do, okay.
You do.
Thank you.
Usually what happens is you either get exposed to this in residency, and that's great because then you learn it early on, or you go out and practice and you realize that the skills that we got in medical school may not be enough to deliver this kind of care. So then you seek it out by going back and doing a fellowship.
You can't be a guy that is, or a gal that is, takes a course in biology and says, okay, I want to do integrative medicine
No.
now.
Well, no, you can't. I'm
I see
sure.
a book by somebody like that claims to do integrative medicine and is not an
No.
MD, I should not read that book or listen to that person.
I think that, again, if you are reading someone who's reputable, that is an MD or even a naturopathic physician, I think there's a lot of wonderful naturopathic physicians that are very knowledgeable about this and are well trained. So I don't think it has to necessarily be an MD, but I do think you need to have some licensed healthcare provider at that level to
And
kind
I'm
of
sorry,
dissect it out.
Not to monopolize this, but just one more question on gluten. I
Gluten.
saw one of the videos that was filmed here some time ago, and I think it was about grains, but gluten was a big
Yes.
part of it. So I know that gluten is seen as a very bad thing for a lot of people.
Okay.
For a lot of
So the question is about gluten.
Yeah.
Okay.
And the question is, if gluten is really that bad for everybody, for the human body,
Okay.
do you think, is the medical field looking at that? I would think that they can do the research and they can focus on gluten and then eventually determine, yeah, gluten is really bad for everybody.
Okay, it's a good question. So is gluten bad across the board for everyone? That's a great question, and I think, let me just think kind of where to start, because there's a lot to go through with that. But I think the first problem with gluten is that a lot of the gluten that we are ingesting now, the majority of it, if not all of it, is a totally different protein than the gluten that, like biblical gluten or gluten of your grandparents or great-grandparents, okay? So the problem is our genes, 10,000 years old or so, our genes have not necessarily evolved enough to eat this, to break down this kind of gluten. That's a totally different molecule, genetically modified, and the problem is that in some patients whose genes have put them at a higher risk of gluten insensitivity, those patients that have what we call HLA, DQ2 and DQ8, those genes that predispose this patient to not being able to tolerate gluten, then the problem is then that gluten ingestion leads to chronic inflammation, can lead to autoimmunity, it can lead to, from that chronic inflammation can lead to other chronic diseases like arthritis, Alzheimer's, diabetes. So the problem is, yes, I don't think that everybody in the world has to avoid gluten. I think that gluten is not the same molecule or protein as it was years ago. And I think that we should be cognizant of the fact that we should limit the amount of gluten in our diet. And if you are one of those patients that is genetically susceptible to having a gluten intolerance, you need to get it out of your diet. And if you don't know if you're one of those patients, get tested by doing a food sensitivity.
That makes a lot of
What
sense.
about
And
your
you guys,
kids? Well, how do you know what to feed your kids or what not to feed your kids? Because I have a thyroid
Test them.
condition, so I'm trying to go gluten-free.
Yeah.
And I'm like, well, why not feed my kids the way I eat, which is I'm trying to do gluten-free, dairy-free, wheat-free.
Yeah.
So is there any harm in feeding our children that way?
So is there any harm in feeding your kids gluten-free, dairy-free, wheat-free? Absolutely not. We're the only mammal that drinks the milk of another mammal. Okay, so why?
My pediatrician, does he say he has to drink cow's milk in 3 servings a day?
I want a study that says you have to drink cow's milk 3 times a day. There's not one study. There is not one study, unless it's put by the Dairy Council, that you need to drink milk 3 times a day.
I even put a phone call in and said, can I do almond milk instead? Because I feel like Is there
Yeah.
something better in cow's milk than, I mean, what nutrients is he gonna be missing out on if I don't give him those 3 servings a day?
Because you got more calcium in almond milk.
Exactly. I mean, there's a lot more calcium in non-dairy type foods. I mean, really, when you look at it, I think the problem is just because, and again, I'm not claiming to be a nutrition expert by any means. I have a passion for it, so I read it like it's, you know, going out of style. But not every MD has a passion for nutrition. And just because we went to medical school doesn't mean that we had a ton of nutrition education. We may have had 30 minutes, maybe, in 4 years of nutrition. So I think that not saying anything bad about our specialty, about our field in general, it's just that a lot of times our evidence is funded by the Dairy Council, it's funded by Big Pharma, it's funded by the farm industry, so we have to look at those studies and see who's funding them so we know what data we're getting. But I can guarantee you, I know of no study that says a child needs 3 glasses of milk a day.
If I cut that out, is there something I need to add into his diet? Like if he doesn't
Yeah,
like
my
almond
suggestion,
milk, or he doesn't like,
yeah, my suggestion, if you're gonna do it, you definitely wanna work with a very knowledgeable dietitian, one that is in the know on current dietitian practices for gluten-free, dairy-free, wheat-free, soy-free, because a great dietitian is worth their weight in gold, and they can help you with making substitutions if you're going to cut out dairy or you're going to cut out wheat.
do you have one that you recommend in the area?
Leslie, she's like an encyclopedia. She's extremely knowledgeable.
And that information, that dietitian information is based on medicine?
Yeah, so Leslie did. She's a registered dietitian. She, has a degree in diet, as a registered dietitian. And she also did a year of integrative nutrition, an additional year's training in integrative nutrition. So, and she works 2 doors away from me and here's me all day long with evidence and studies. And, I'm constantly putting studies on her desk. So, yeah. I can guarantee, I don't know, again, I don't want to keep reiterating that, but it's incredibly important to me that what I tell my patients is evidence-based. So I would never tell a patient something that I wouldn't want, that I would want my doctor to tell me unless they knew it and they could reproduce it.
Right. So
Okay.
I understand that, and I like that. But if you then refer someone to a dietitian.
That's why I said my dietitian.
Right, okay.
I didn't say just pick up the phone book and find a dietitian. That's why I have one dietitian, because I trust her and I know and I trust what she's going to tell my patients. Not saying that there's there's one other wonderful dietitian, Amy, in the audience. I've never worked with Amy. I bet she's amazing. It's just I don't know what Amy's going to tell. I don't know her style. But once you get to know a dietitian and work with them, that's where I know what I know what Leslie's going to say. I trust what she says. Any other questions? Yeah.
We have a daughter who we've had tested on a food sensitivity test, and she's gluten sensitive, dairy sensitive, and beef. That includes eggs. That does include egg whites as well.
Okay. So food sensitivity that showed a sensitivity to gluten, eggs, beef,
And
Dairy. Okay.
Currently, we have our own coconut milk or almond milk.
Okay.
The supplements aren't an issue, but my question is, there's a lot of crap in gluten-free bread. And
Absolutely.
she wants bread.
Yeah.
What bread can she have? What we notice is she's not gonna break out and go to the hospital, but she'll get very edgy, very irritated. She'll
Okay.
have, sometimes she'll clear her throat or have some transient tics, whatnot.
Yeah.
What
So
should I do for her carb? Because
Yeah.
she really wants a grilled cheese sandwich. So I use dairy-free cheese, but what kind of bread?
Yeah, I think that's difficult because when you do go down the gluten-free aisle and read what is in gluten-free products, it's not any better and could sometimes be worse than the gluten itself. Because, yeah, exactly. So I usually tell patients, when I talk about a gluten-free diet, it's not gluten-free muffins, gluten-free crackers, gluten-free bread, gluten-free bagels, gluten-free yada yada. But I understand. How old is your daughter?
She's fine.
She's 5. So a 5-year-old wants a grilled cheese sandwich, right? Bottom line. Because her friend has a grilled cheese sandwich, so she's going to want it.
That take fresh. She wants
It does, yeah. So you kind of have to, and it takes time, but you kind of have to rewire how they think about eating. You really do. And I know that's hard at 5, especially when she didn't have to be gluten-free before, and now you're trying to change these 5-year-old habits, per se. The problem is multiple servings of gluten-free things or even gluten-containing things in a day is not how we should be eating. So in general, if my daughter was 5, I have a 6-year-old daughter, so if my daughter was 6, would I want her eating that stuff anyway, even if she wasn't gluten-free, and then trying to convert it into a gluten-free fashion? I'm not sure, So I think the problem is there are several gluten-free breads out there, but they're expensive and sometimes they're not easily found. So that's why I say, if you can try to work with someone who's kind of solved this problem for other families already, so you don't have to recreate the wheel, that's where you're going to save a lot of time, money, and frustration. If you can just sit with somebody who has lists and resources and suggestions, so that way you're not having to do it all from scratch.
Does Leslie have that?
She does.
I also say gluten-free bread contains eggs.
Yeah.
One of them doesn't, it's like rice bread, but yeah, I found out that Udi's did contain eggs, and so I
Yeah.
had to pull it from that.
Yeah.
She had me off of gluten, and we did find, we were eating a Mediterranean dish.
Yeah, Lois.
My husband and I for breakfast, and we replaced the pita with a corn tortilla, which didn't change the taste any at all. It was made just fine, and she did say that was okay. So I
Yeah,
think
that's good. Thank you, Lois. Yeah, I mean, you can make substitutions. Definitely, it doesn't have to necessarily be bread of what we think of bread. Again, a corn tortilla, cauliflower crust for pizza. I mean, there's lots of ways to make something as close to our favorites as possible without gluten, if you have to be gluten-free.
Are you familiar with Sally Fallon's Nourishing Traditions? And what do you think about the traditional methods of soaking and fermenting grains that allegedly, partially at least, break down gluten?
Yeah. I'm not familiar with her work specifically. I'm a little bit familiar with the process of soaking and fermenting the grains to help them with both digestibility and especially when it's a gluten-containing grain. I do not have any evidence-based answer for that, put it that way. It would all be anecdotal.
That was our next question. Okay. This one's about an article in the October newsletter, the article on calcium and bone health.
Yeah.
And in the article,
yeah.
you mentioned many different
This
supplements.
is Nina's question about the bone health. Yeah.
Yeah.
And I forgot to put the boxes of those, like the contents of Formula 1 and Formula 2. That was just kind of what we named them. But I can share that with you. I can give that to you, Nina. It's basically, the gist of that question is, what do you need for osteoporosis, or what do you need for bone health besides calcium? Because again, I think sometimes we have this false assumption that calcium is so wonderful for our bones. And yes, a little bit of calcium is great for our bones, but it's just the tip of the iceberg. We need vitamin K2, we need strontium, we need boron, we need phosphorus, we need vitamin D. I don't want to forget that. So there are products that have all of those wonderful minerals in them. And in the article about osteoporosis, it talked about 2 different formulas. One formula is very similar to Orthomolecular's Pro Bono. Pro Bono, if anyone's familiar with that product, that has, it's a comprehensive bone building multivitamin, so to speak, because it has all of those bone-building minerals. And formula 2 is basically just the addition of strontium at 680 milligrams a day, because strontium is also very, very effective at bone building.
What's that?
Strontium, oh, the first one? I'm sorry. Oh, the name of it? Pro Bono is the first one. PROBONO.
Talking about vitamin D with
Yeah.
winter coming.
Yes.
How much should we be taking when we're, in the 6-month blackout?
Yeah, so good question. What's a good dose of vitamin D to be taking, especially October through March, where we may not be, at least in Illinois, we're not going to be getting much vitamin D absorption from the sun. So a lot of it depends on what your level is, like your blood test. But I'd say if you didn't have a blood test and you just wanted an answer for just a general recommended dose, I'd say somewhere around 2,000 to 4,000 units of vitamin D3 daily. There's vitamin D2 and vitamin D3. D3 is better from an absorptive standpoint. And so anywhere between 2,000 to 4,000. I take 5,000 units a day only because my levels are usually pretty low and I work a lot. I'm not outside very much in the winter.
So if you're susceptible to winter blues, you may want to consider taking more.
Yeah, for the most part, if you have normal, if you have a normal parathyroid and you're not sensitive to vitamin D, you have normal renal function, kidney function, even though vitamin D is a fat-soluble vitamin, you can take up to about 10,000 units a day and not really get into trouble. I don't necessarily recommend that because I'm not sure. If I have somebody on that high of a dose, I'm checking their levels pretty often.
Okay, here's a question about the omega fatty acids.
Oh, yeah.
Okay, everyone knows that omega-3s are good for heart health, but I'm confused about omega-6s and omega-9s.
Okay. Yeah, so omega fatty acids, omega-3 fatty acids. So I think everybody's pretty up to speed on omega-3s, but what about omega-6 and omega-9? So the rule of thumb is the odd-numbered omegas are the good ones, so like 3, 9, and now 7 to some degree, and I'll talk about that because Kathy asked about omega-7s. Omega-6s, so when you think of omega-3s, those usually come from green leafy sources. So algae, that's where the fish get them, and the fish eat the algae. The fish then assimilate that omega-3 into their fat. We eat the fish, and then we get our EPA and DHA. You'll get some omega-3s in other green leafy sources as well. That's how grass-fed beef get their omega-3s, because they're eating grass. It's green, usually. Omega-6s come from seeds and grains. So if you have cows that are in factory farms and they're being fed grain, that cow's meat or fat is going to have omega-6s. And the reason why that's important is because omega-6s, for the most part, are pro-inflammatory. They increase our levels of inflammation, whereas omega-3s are anti-inflammatory. But we need omega-6s. There's no doubt we need a little bit. Our hunter-gatherer ancestors, their omega-6 to omega-3 ratio was like 3 to 1. Now our omega-6 to omega-3 ratio is like 20 to 30 to 1 because everything in our diet, for the most part, has corn, like corn syrup. Corn is a filler. And soybean. So we get plenty of omega-6s in our diet, in the standard American diet. So for the most part, you don't necessarily need to supplement omega-6s because you get enough in your diet, with the exception of a few forms of omega-6 like borage oil or evening primrose oil or black currant oil. Those types of omega-6s can actually be beneficial for certain conditions. They work well for, they have some effects on menopausal symptoms. They work great for the cyclic breast pain. Some even have an effect on eczema. But for the most part, I tell patients you don't need to supplement omega-6s. You get enough, way too many in the diet. Omega-7 fatty acids is a relatively new player. It's palmitoleic acid is omega-7, and that's just relatively new. And I did a PubMed search on omega-7 fatty acids, and there was 2 studies on that one that came out. One was in the American Journal of Cardiology in August of 2012, and it looked at a group of male physicians and their risk of cardiovascular disease and whether or not omega-7s improved their risk of cardiovascular disease. And that study showed it did not. And then the other study was inconclusive. It was kind of a null effect. But at this point, I would say because of the lack of evidence of omega-7 fatty acids, I don't recommend starting to supplement with those. There is one company that has put out a product that's omega-10, it's omega-7 plus omega-3. But at this point, in my opinion, because of the lack of evidence-based information on omega-7s, I'd stick with your omega-3s. I think that's an area that we're going to see more research on with insulin sensitivity, Kathy, and
the DHA is more important than the EPA, or in higher amounts?
The DHA is more important for brain health. So if you have a patient that has cognitive decline, or you have a child with autism or ADHD, the DHA is definitely more beneficial for that. EPA tends to be, I think of it more for our cardiovascular health and our endothelial, our blood vessel health. So EPA for that.
I have a question just popped in my mind. My husband is considered a bleeder. I guess
Yes.
you call him. And I read some, because he always used to take fish oil. I read that if you have that problem, you should not take fish oil.
That's a good question. So does fish oil have an effect on our bleeding?
Yeah.
It can in high doses. And so patients who are on Coumadin or other blood thinners, you do have to be careful with the amount.
Anything like that.
Okay. So the data, what they find in the studies is that you can be on up to about 5 grams of EPA and DHA a day before it really has an effect on bleeding time.
Because it's more beneficial than not. Okay.
I would agree.
Because I took him,
But-
I stopped getting it, and I kept thinking I'm going to ask you about it, and I
Yeah.
just remembered to do that. So
Yeah.
you could safely take it.
Yeah, so the studies say up to about 5 grams, but I wouldn't automatically go up to that right off the bat. I would work my way up. And really, he probably doesn't need 5 grams. That's kind of a hefty dose, depending on the reason why you're using it. So if he was at 1 gram or 2 of EPA, DHA a day, that's probably enough.
And can they take if they are on Coumadin, or only under a physician's direction?
I say it's fine for them to be on it if they're on Coumadin, as long as their physician knows they're on it, and then is going to titrate that Coumadin dose accordingly. Yeah.
If you eat healthy plant-based diet, do you need omega-3 supplement? Do you need to take fish oil? Is it possible just to take it through healthy foods?
It's a good question. So if you eat a plant-based diet, will you get enough omega-3s? In my opinion, no. You're going to get some omega-3s like from flax, walnuts, but that conversion in our body is not as efficient as it would be if you were getting the omega-3s directly from wild Alaskan salmon or black cod, sablefish, or sardines, all 3 rich sources of omega-3s. So you can get some omega-3s from a plant-based diet, there's no doubt. I personally don't think you can get enough without supplementation. But you can take algae-derived omega-3s. You don't have, if you want to avoid animal products altogether, just take an omega-3 supplement that is derived from algae, and Nordic Naturals makes a beautiful one.
Thank you.
Mm-hmm. Yeah, Nina.
If someone has an early dementia, and you said DHA would be good for
Yeah.
them, what dose?
Yeah, so if someone has early dementia, DHA in what dose is helpful? We're looking at usually about 1 gram to 1.5 grams of just DHA alone. You can add EPA for some of the heart benefits, but if you strictly want the DHA, I'd say, if you can get 1.5 grams in, that would be great. And the best way to do that, to get a higher dose without having to take multiple pills, is to buy the concentrated fish oil, or you can, I mean, cod liver oil has a lot of DHA, but the concentrated fish oils you can get 5 grams in 1 teaspoon of EPA and DHA. So it's much more convenient than taking 8 or 9 capsules a day.
Can you just get it over the counter in any drugstore?
The one I use is Nordic Naturals. Yeah, they make a great concentrate.
Would you say the same about Carlson? Isn't that also?
Carlson's another good brand. They do. And I'm not familiar if they make a concentrated. I'm sure they do. I'm just not familiar with how many grams in 1 teaspoon. But yeah, Carlson's is a good brand. Yeah.
How does the Mega Red krill oil compare to the fish oil?
Yeah. So krill oil. It's just an alternate source of omega-3 fatty acids from krill versus salmon or sardine. Going back to the evidence, there's not, in the medical literature, there's not the evidence that supports krill oil for its cardiovascular and neurologic benefits as fish oil. So I think it's been marketed very nicely, but again, if we're going to go back to the science is there for fish oil, but not krill yet. Mm-hmm.
What do you know about Juice Plus?
Juice Plus? What do I know about Juice Plus?
Good or bad for kids, because it's promoted as a whole
Yeah.
natural, like the straight source, I guess.
Yeah, I would say that it has potential. I don't know. I'm not real familiar with those products, to tell you honestly. I've not heard anything or read anything bad about Juice Plus. But is it a pyramid scheme? It's not a pyramid scheme, right? Okay, good.
It's
So,
actually just, I guess, a tap that gives 15 vegetables to a child in a serving and a gummy and the fruit.
Like a Whole Foods.
like a Whole Foods? Oh, then I'd say it's probably fine. As long as it doesn't have fillers, it doesn't have gluten as a filler, it doesn't have dyes or soy. Because a lot of those you have to be careful on the fillers, because they'll use corn, they'll use corn starch. So if your daughter has a corn allergy, you got to make sure they don't have corn starch. You have to make sure that there's not soy, dyes. So that's why I said I haven't heard anything bad about the product. I just don't know that product like I know the ones that I have here, because those I've memorized, like tried to.
You've got something that you can give your kids, like 15 vegetables in one day if they don't like them to begin with, and you just give them a little.
You know, I have to admit I'm lucky in the fact that I'm pretty fortunate. My kids will. I juice the vegetables for them, and I give them to them. So and the fruit. So I try to give it to them in that form, because I know the antioxidant is going to be a little bit greater because I've just juiced it. It's more alive. But if you can't do that, or you don't have time to do that, or your kids won't drink it, then I think that would probably be a nice alternative. Yes.
If you have a patient with Hashimoto's and hypothyroid, what's the worst thing that you recommend to them dietarily or any other way? And then what's the success rate that you see with healing that thyroid?
Okay, so if you have a patient with Hashimoto's, which is autoimmune thyroid disease, what is the first thing I recommend for them? Number 1, get off gluten. Number 2, look at your other food sensitivities. So run the panel to see what else may be causing that molecular mimicry between that food protein and your immune system attacking it, because it's kind of similar to your thyroid. Then the other thing is make sure that you're nourishing your thyroid with what it needs. It needs selenium, it needs zinc, it needs vitamin B12, it needs ferritin. So all of those things are important for your thyroid to go for your conversion of free T4 to free T3, which is the active thyroid hormone. That's kind of where I start. I look at, you can look at heavy metals to see if there's an influence against, with heavy metals. You can also look at hormones, because hormones are also, the way I think of thyroid, it's kind of thyroid, adrenal, and pancreas, and hormones. So it's kind of this triad to me. So I want to make sure that cortisol levels are okay, as is your other hormones, female hormones. But that's where I start. The first thing is definitely gluten.
And what's the success rate that you are able to see? I mean, how much success do you see with people?
Well, I think it's variable, because everybody's motivation is a little bit different. I can I can lay it out for them, but when they leave this office, I have no idea how motivated they are to get rid of gluten and the rest of their food sensitivities and take a supplement that supports their thyroid and exercise and eat organically and get rid of pesticides and look at the parabens in their cosmetics, because all of those are endocrine disruptors and they will all affect your thyroid. So if I send them out at the door with a list that's 20 pages long of what they have to do, we baby step it. It takes months for thyroid antibody levels to go down. It's a slow process because we're just chipping away at what's causing them.
So if like I cut out gluten, wheat, and dairy for like 3 months, would you expect?
I can tell you from my experience, it takes a year or two for thyroid antibodies to drop to what I think is a significant reduction. It's a slow process. Oh yeah.
With the lifestyle change.
Oh yeah. Thyroid antibody levels will drop, but it's not quick.
How high do those antibodies have to be before you're concerned? Or should you be
One
concerned?
above the normal. One above the normal. Because if you have antibodies, if your thyroid antibodies are 1,500 or your thyroid antibodies are 36, that's still telling me that your immune system is attacking your thyroid. And we have to try to figure out why. Now, obviously, if it's that much higher, we have more work to do, but it's still.
On your TSH level.
On your TSH level.
Did you see it fluctuate in that particular?
Oh,
type of
yes,
thing?
yes. TSH levels will fluctuate significantly for a number of reasons, irregardless of the thyroid antibody levels, because TSH is one of those lab tests that's not perfect by any means, and it will fluctuate.
To a great degree, or just a little bit, or?
With?
Well, with the Hashimoto's, I saw I had a 10, and then then I had it retaken a couple months later, and it was on no treatment.
And it was normal?
And it was back to normal.
Yeah, it definitely will fluctuate, and that's why just looking at that number alone is not adequate. You have to look at what your free T3, free T4, reverse T3, got to look at the whole picture, because the TSH will fluctuate, there's no doubt.
Right, and I read where it does show we have to look at the other, the other factors that go into
Yeah.
that, but if all those other factors are normal.
The best book I can tell you about that, the second edition just came out. It's called, and again, this is written more by a layperson, but there are MDs that have contributed to this book, and it's called Stop the Thyroid Madness. There are a lot of MDs that have contributed to that book.
But it seems like my GP really couldn't tell me a whole lot about that to help me kind of understand what was going on. So I just kind of felt like they should know more about understanding what the lab values were.
Yeah, that's kind of that'll be a controversy till the end of time.
I think so.
No doubt about it.
We'll do the book, stop the.
Yeah.
Is it true that, I read that you, in order to have an autoimmune disease, you more than likely would have gut permeability?
I agree with that. So is gut permeability linked to autoimmunity? Absolutely. And if you read any of Dr. Fasano's work, he is a pediatric gastroenterologist out at Mass General. He is the doctor that pretty much cracked the code on gut permeability and celiac disease and autoimmunity. That is, again, now probably, other than microbiome, that's kind of our new frontier in medicine, is intestinal hyperpermeability and autoimmunity, because that's I think, where a lot of medicine is going. Yeah. So the first thing that I do with an autoimmune patient is heal their gut, because that's pretty much, the majority of our immune system is in our gut. It's called Peyer's patches. That's where our immune system lives. Yeah, Lois?
You mentioned you quickly mentioned makeup, cosmetics.
Oh, yeah.
Is there a brand that in general you could just?
Yeah, the best resource I have for that, to give you an idea, is if you go to the Environmental Working Group website, it's ewg.org. ewg.org. They have a section called Skin Deep, and that's that they rank cosmetics in terms of their purity and whether or not they contain parabens and dioxins and phthalates and all those things that you don't want in your skincare products. So go to that website, Lois, and click on Skin Deep. They have moisturizers, they have makeup, they have lipstick, nail polish, you name it, they have it.
What was the extension on that?
EWG.org. Yeah. All right, I don't want to bore anybody. Anybody last minute questions? We'll wrap it up and then we'll do our giveaways. Yeah, Lois. You're on a statin.
Yes, because, is it known if it causes hair loss?
Do statins cause hair loss? It's a good question. And I think that potentially that answer could be yes, because I do think that any drug that has the potential to deplete our nutrients can cause hair loss. And statins can deplete certain nutrients, the most important of which is CoQ10, but it does deplete vitamin D, B12, some other things. So yes, I would say that it could. It's not necessarily going to be in the top 5 list of side effects, but I'd say it's a potential cause.
So if I thought I was having that, if I change, would you ever change from, like, I think Crestor would, you took Lipitor instead, statins
Yeah.
and statins?
Not necessarily. Not all statins are the same, and so you'd want to definitely just have a conversation with your prescribing physician about what other alternatives, maybe switching to a different statin or something altogether.
I had a question with grass-finished beef and organic.
Grass-fed beef and yes.
What's the difference? And I heard that they're trying to lessen the rules for things being organically, that there's a movement to make it not so stringent. Do you have any thoughts on that?
Yeah, so is there a movement towards making it easier to label your product organic with less regulation? And I think that there is definitely talk of that, and there's been talk of that for several years. The problem is I think that it's an area that definitely needs more financial resources devoted to it in terms of regulating that, because I agree there's companies that I think may not be in it for the good of humanity, just in it because organic is a very hot topic. So I think the Huffington Post has had a couple of articles about that recently in terms of the regulation of organic farms and organic manufacturers. So yes, to answer your question, that is happening. I don't know the answer, and I'm not sure how they're going to, what's going to happen in the end. But that's, like I said, check out the Huffington Post. They had a couple of really good articles on it.
Have you seen the movie Forks Over Knives?
I have. Have I seen the movie Forks Over Knives?
What do you
Yes.
think about that they are proposing in that movie?
Yeah, so Forks Over Knives was the work of Caldwell Esselstyn and T. Colin Campbell. T. Colin Campbell wrote China Study. And Caldwell Esselstyn, I believe, is a cardiologist. So Forks Over Knives is the movie, the documentary about a plant-based diet and its effect on reducing the burden of cardiovascular disease. I liked that documentary. I thought that it was very powerful. And again, I feel that if you're going to look at it as a spectrum, you want the majority of things on your dinner plate, at least half of your dinner plate should be vegetables. And then if you would like, if you're going to have a little bit of animal protein or animal protein alternative like a soy-based, that's fine. But I don't think I think that you can have the benefits, the Mediterranean diet style benefits of a plant-based diet without completely being 100% free of animal protein. But their work is powerful. And if you read China Study or if you read Esselstyn's work, they really do make it look achievable. And it is. I mean, they did a nice job. I just think for most people, including myself, it wasn't sustainable. I could not sustain that. One, I have a medical problem that I needed to add back a little bit from an iron standpoint, but I don't think it's sustainable for a lot of people. Completely animal-free protein diet for the rest of their life.
Is it time-consuming or?
Is it time-consuming?
I mean, why is it not sustainable? Is it just too much work to?
I think there's multiple reasons, at least for me, why it wasn't sustainable. Yeah, Ray?
Similar question to the gluten, but with GMOs. And I know, and in this one I did do some research, actually a lot of research, about medical studies on GMOs from both ends of the, from both camps. So your opinion on that, if you have done research on that in the medicine,
Yeah.
is the GMO is bad for everybody, and can they be painted with a big broad brush that, you know, all GMOs are the same?
Okay, so the question is GMOs, do I think they're globally bad for everyone? Yes, I do. Is there a study that says that GMOs are bad? There are plenty of studies that show that GMOs are bad. The problem is, again, Monsanto has a very, very, very strong lobbying force in Washington, okay? So we're up against a giant, and unfortunately, I don't think all of the data on GMOs reaches the average person. But the medical studies that I have seen on GMOs, at least in some, it may not be in humans, but very, you know, insects or animals in general, are not looking good. And I extrapolate, whether that's good, bad, or not, I extrapolate, and I believe that most of why we have intestinal hyperpermeability is because when you put a Roundup-ready crop into your stomach, it's going to wreak havoc. And that is just my theory based on being a scientist. When I look at it with my scientific mind and I think, okay, that makes the stomach of insects blow up, what is it doing to my intestinal permeability? Just a thought. Now, is there a study in JAMA last month that says that? Probably not. But I'm using my power of deduction as a scientist to say probably.
And why did Europe ban them?
And why did Europe ban them? Just a thought.
Europe banned all.
Yeah. All right, guys. Thank you. Now we're going to do some giveaways. So, all right, guys. Thank you. Thank you.